This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
It's
Supposed to
second.
help first or
Medical Dilemma.
Del Rosario, and you're tuned in to Medical Dilemma. In a previous episode, we tackled the big C, particularly the cancers of the reproductive system in women and prostate cancer in men. Today, we take a further look at the big C, specifically at colon cancer and breast cancer, and helping us to understand the matter are two very successful surgical oncologists. Joining me for the first segment is Dr. Ramon S. Estrada, colorectal surgeon connected to Manila Doctors, Makati Medical Center, and St. Luke's Global in Taguig. He is currently the head of colorectal surgery in Makati Medical Center. And he was also past president of the Philippine Society of Colorectal Surgeons and a cum laude graduate of the UST Medical School. In a later segment, we will have Dr. Mark Ko, surgical oncologist connected to Manila Doctors Hospital, UP Philippine General Hospital, currently chairman of the Committee on Cancer of the Philippine College of Surgeons. All right, welcome to the show, Dr. Estrada.
Maraming salamat. Thank you for inviting me to enlighten you in this show.
Yes, doctor, it's our pleasure to have you here on the show. Now, maybe as an opening statement, you could describe what exactly is the scope of your specialty.
Well, a colorectal surgeon is a full-fledged general surgeon who has gone and taken extra specialization into the study and of the small intestine down to the colon and into the anus. So we handle both benign and malignant conditions. So cancer and non-cancer conditions of the small intestine, the colon, the rectum, and the anus.
Okay. Do you have a slide or a picture that we could show the audience to explain, what exactly is the scope of of your specialty?
Well, I have a diagram here about what the colon looks like, and
may we have the camera focus in?
And this is basically the colon. So as you eat food, from your esophagus it goes out to your stomach, eventually goes to your small intestine, and this is the start of the colon, where the appendix is attached. So the appendix is attached to the first portion of the start of the colon. It goes up and it becomes the transverse colon. You have the left side of the colon, eventually becomes the rectum, and the lower or the outer portion is called the anus.
I see.
That's the scope of the colorectal surgery.
Okay. Now, you mentioned that there are several conditions that you examine in your specialty. What are these conditions?
Well, very common among our conditions for benign conditions, we have hemorrhoids, we have fistulas, fistula and ano. These are very common conditions that are seen among adults. For women, it's the hemorrhoids. You also see hemorrhoids, by the way, in men.
Yes.
For malignant conditions, and it's a colorectal carcinoma. So it's
Colorectal
cancer of the colon.
carcinoma.
Yes, and the rectum. These are the most common conditions seen in our specialty.
Okay. How prevalent is a colorectal carcinoma these days?
Well, if you're going to look at the 70s, colorectal cancer was ranked around number 6.
Number 6.
Yes. Right now it's jumping up to around number 3. In some very advanced countries, it's even going up to number 2. So there really is a rise of colorectal cancer.
And is there an explanation of this increase in?
I think our change in lifestyle is very important. Our change in our dietary habits. We eat less roughage, less fiber, and because of this, the food that's supposed to have the carcinogens or the cancer-containing components stay in that colon for a long time. And we know eating a lot of cholesterol in the form of red meats may predispose you to this condition.
So I suppose the prevention of such a disease would be doing the opposite of what you have just described.
Yes. So, well, the fast food era is there, and the expense of the vegetables has gone up, and that's the reason why probably colorectal cancer has gone up too.
I see. Now, when we say colorectal cancer, does it occur in any particular spot of the colon, or does it occur anywhere?
Well, it can occur anywhere. It can even occur in the appendix.
Even in the appendix?
Yes, down to the anus. But the most common area that it would occur is in the sigmoid and in the rectum. That's the most common area. And the other common area would be the right side or the cecum, or the right side area.
Is there an explanation for that?
I'm not sure of the explanation. There really is no known basis at the moment why those are the areas of predilection.
Okay. Now, how would a common person detect cancer in the colon, or should he go to a specialist to have a checkup done?
Well, it's been recommended by almost all societies worldwide that if you are not or do not have the family history of cancer, it is recommended that by age 50 you should have your initial colonoscopy.
Okay.
And we know that the reason why a colonoscopy is done is because most of the time the cancer starts from a polyp. A polyp is an abnormal growth of the lining of the colon, and because of this rapid growth, it transforms into a cancer. So if you have the colonoscopy and the polyp is seen, what the endoscopist or what the colonoscopist would do is to remove it, to snare it out, and to have a biopsy. And because of this, you will avoid having it turn into a cancer. Now, if it has turned into a cancer, the bigger or the higher the stage that it turns into the cancer, then the poorer the prognosis. Which means to say, if you're in the stage 1, then you have a better chance of cure.
And what's the survival rate of
well, if it's a stage 1
cancer colon? Yes.
The average survival rate of colon cancer is around 50%.
50%.
Yes, it's around 50%.
And that's at stage 1.
No, this is for all stages.
The more advanced stages. Yes.
For stage 1, you can go up to 90 to 95%.
95%.
Yes. And as you reach stage 4, then you go to around 10% to around 5%, 5 to 10%. So the higher the stage, then it becomes harder to treat, and the worse the prognosis.
I see. So once it's established that there is cancer of the colon,
Yes.
How does a doctor go about treating the condition?
Well, first is we should have goals of treatment in these patients. First goal we have to do is, because the patients present with bleeding, so you like to stop the bleeding, the patient will eventually develop an obstruction, which means to say that the stools won't go out through its normal route, which means to say through normal defecation or normal bowel movement. Then eventually the patient will have to bring out the stool on the opposite direction, which means to say into the mouth.
Into the mouth.
So that's what you try to avoid. So when you do cure them, you want to stop the bleeding, you want to cure the obstruction, and eventually you want to cure the patient. So there are three goals that you want to achieve. Okay. If it's a colon cancer, it's easier to treat compared to a rectal cancer.
Okay, well, thank you so much, Dr. Estrada. We'll have to take a break first for a few words from our sponsors. Don't leave this channel. We'll be right back.
Especially in such a place where anything can spread like wildfire. When you share something to a public, you find that experience, and that experience so rich it could change others.